monster chapter. I apologize for that, but it's really long. We're going to talk about other addictions and other drugs besides the ones that we normally talk about. So let's go ahead and get started. Other drugs, inhalants, volatile liquids, aerosol sprays, gases that come in pressurized tanks. These substances have many of the same psychoactive effects of street drugs. Sports drugs, natural and synthetic substances, they accelerate the healing of injuries, they increase performance, they alter the state of the athlete's consciousness. Hard to classify drugs. Drugs such as animal extracts, herbal preparations, smart drugs, and smart drinks. Nootropics. They have been used for their psychoactive effects. They have been used to improve mental health. They have been used to improve physical health. Inhalants are used because the user finds it stupefying, intoxicating, and occasionally psychedelic. There are three main groups of inhalants: volatile solvents and aerosols, volatile nitrites, and anesthetics. Most of the volatile solvents and aerosols are synthesized from petroleum and mixed with other chemicals. Hydrocarbons are found in glues, gasoline, and nail polish remover. Many aerosols are inhaled for their propellants rather than their ascribed contents. Other volatile organic compounds include esters, ketones, alcohols, and glycols. The volatile nitrites include butyl and amyl nitrites. These drugs are used as vasodilators for the people with heart problems. They've also been used in air fresheners. Illicitly, they are used recreationally at parties, but especially in sexual situations. Anesthetics are used to block pain or induce unconsciousness for medical procedures. Nitrous oxide is used in dentistry for anxious patients who do not wish to use Novocaine. Also called laughing gas, it is not uncommonly used at parties to induce giddiness and euphoria. The most widely used inhalants are nitrous oxide, nitrites, gasoline, glue, spray paint, aerosol sprays, lacquer thinner, and correction fluid. Inhalants are sought because they are quick acting with intense effects. They enter the bloodstream within 7 to 10 seconds and may last from a few minutes to an hour. They are cheap, readily available, and widespread. There are more than 1,500 chemical products that can be inhaled for their psychoactive effects. They are readily accessible to children and adolescents, as many exist in any garage or home. They have more direct toxic effects on body tissue. There's a lack of awareness of inhalants as drug problems. Inhalant abuse is most prevalent among adolescents. Inhalants account for from 700 to 1,200 deaths in the U.S. per year. This is a worldwide problem as cheap highs are sought by the young, the poor, the street children, recent migrants to cities, indigenous peoples, and children of parents who work at home with volatile chemicals. The inhalant of choice in many poor countries is gasoline because of its availability. Inhalants are most likely abused by 12 to 17-year-olds and more females than males. This problem was especially serious in the 1990s, but has since dissipated. American Indian and white adolescents are more likely to use inhalants than blacks or Asians. There are 7 methods of using: sniffing, breathing in the inhalant through the nose directly from the container; huffing, soaking material and putting the material over the mouth and nose; bagging, soaking material and placing the material in a bag to be inhaled through the nose or mouth; spraying, spraying the inhalant directly into the nose or mouth; balloons and crackers, puncturing a can of inhalant and capturing it in a balloon for inhaling. And that's what was going on there. Masking, spraying an aerosol in a bag and then putting the bag over your head and then just putting it on your clothing and breathing it from time to time. Volatile solvents are carbon and hydrocarbon-based compounds that turn to gas at room temperature. Gasoline, gasoline additives, paints, especially metallic paints, kerosene, air dusters, paint thinners, lacquers, nail polish remover, spot removers, glues and plastic cements, and lighter fluid. Volatile solvents are absorbed very rapidly into the blood and move to the heart, brain, and liver within 7 to 10 seconds. In that time, you get temporary stimulation, elevated mood, reduced inhibitions, impulsiveness, excitement, irritability, dizziness, slurred speech, unsteady gait, and drowsiness. These inhalants are exhaled by the lungs and excreted by the kidneys. After prolonged inhalation, the user may experience delirium with confusion, psychomotor clumsiness, emotional instability, impaired thinking, and potentially going into a coma. Long-term effects of inhalant use: arrhythmias and myocarditis. Myocarditis is an enlarged heart. Pulmonary hypertension, respiratory distress, and lowered breathing capacity. Liver toxicity. Carboxyhemoglobin may cause brain damage. Carboxyhemoglobin is hemoglobin that doesn't have enough hemoglobin in it. It's a different form of hemoglobin, and it's non-functional. Some inhalants may cause neonatal growth retardation, odd facial features, and tremors in newborns. So it's not safe for a pregnant woman to do inhalants. While most huffers move on to other drugs, those who stay with inhalants can expect some fairly debilitating effects: poor coordination characteristics, inability to concentrate, weakness, disorientation, weight loss, memory loss due to hippocampal interference, poor problem solving, difficulty controlling one's behavior, blood irregularities, and potential chromosomal damage. Chronic huffers tend to have antisocial personality disorder, but it is not sure whether the huffing causes the behavior or the environment that they come from. These individuals also tend to use whatever drugs they come across. The most widely abused substance is toluene, also known as methylbenzene, because it is such a good accelerant and is in so many products. It's in glues, drying agents, solvents, thinners, paints, inks, and cleaning agents. 65% of chronic abusers of toluene have neurological damage. And that's how you do it. Trichloroethylene, TCE, is another common solvent found in substances used for huffing. Correction fluid, paints, metal degreasers, spot removers, extracting oils and fats from vegetables. It causes depression and moderate hallucinations. If used heavily, it can cause neuropathy. Some of these neuropathies can be permanent. N-hexane and methylbutyl ketone, or NBK, are solvents used for glues, solvents used for adhesives, diluents for plastics, diluents for rubber, in the production of laminated products, as a paint thinner, as a solvent for dyes. N-hexane and NBK have been shown to cause neurological damage, especially in the brain. Recovery can take up to 3 years. Small molecule alkanes are gaseous at room temperature and cause cardiac arrhythmias and sudden death, and include methane, ethane, butane, and propane. Large molecule alkanes are also neurotoxic and include hexane and pentane. Methane, you get methane. If you've ever passed gas, if you've ever farted, then what you were probably farting was methane. And of course, if you've ever been in a room with another animal and that animal farted, what you were smelling was methane. There are some fecal material that has a lot of methane in it. Pig manure, for one thing, has a lot of methane in it. Cow manure has a lot of methane in it. I was living in Montana. Montana has a group of religious isolates called Hutterites. Hutterites are similar to the Amish or the Mennonites. Each colony of Hutterites would produce they had a specialty. Some raised chickens, some raised pigs, Some grew corn, and then they would just trade it back and forth because, well, they were of the same sect. Anyway, there was a pig farm, and they had a cement um, area where they put their pig manure, and it was down below the ground level, and they would just scrape it. It was made out of cement, and they just scrape the manure into this cement culvert. Well, one day a man was doing it by hand. He was using a rake, and he raked the manure into the culvert, and he slipped on manure on some of the manure, and he fell in. Well, his wife was standing there, and she reached down to pull him out, and he was dead before he hit the manure because of the excess methane. And as soon as she leaned into the culvert, she was dead as well. It was one of those tragedies that you hear about that you think, really, pig manure's that bad? And the answer was, yeah, yeah, pig manure's that toxic. Anyway, they both died. Gasoline is readily available and used as an inhalant, especially on American Indian reservations. The effect only lasts for about 3 to 5 minutes. Not only are the hydrocarbons neurotoxic, but the solvents, metals, and additives can cause problems as well. They can cause insomnia, tremors, anorexia, paralysis, and lead poisoning. This, of course, leads to brain, liver, bone marrow, kidney, and lung damage. Residual effects might last for 5 to 6 hours. Over half of all inhalant deaths are due to gasoline inhaling. Alcohols are the most frequently abused inhalant solvents. They come in 3 different forms: methanol, ethanol, and isopropanol. When inhaled, alcohols can produce a mild high along with nausea, vertigo, weakness, vomiting, headaches, and abdominal cramping. And this is a picture of an individual huffing alcohol. For emergency room personnel, it is important to know the warning signs of solvent abuse. And of course, I keep telling you that I worked in the emergency rooms for 30 years, and we would come in contact with this not on a daily basis, but well, somebody was coming in with something just about every day. They were drunk, they were high on marijuana, they had overdosed on heroin. There were huffings, the people that were huffing inhalants. Anyway, this is one of the things that we had to watch for, and the nurses were really good at this, especially emergency room nurses and doctors, because they had seen so many of these. Solvent abuse, you see headaches, chemical odor on the body or clothes, and that's a big one. That's huge, because if you smell any of these chemical solvents, then you can be pretty sure that the problem is that they inhaled something they shouldn't have inhaled. Red, glassy, or watery eyes with dilated pupils, nosebleeds, inflamed nose, rashes around nose or mouth, slow, thick, or slurred speech, staggering gait, disorientation, lack of coordination, pain in the chest and stomach, fatigue, nausea, shortness of breath, loss of appetite, intoxication, irritability and aggression, seizures, and coma. If we see any of those things, then we can think possibly it was a solvent abuse. A lot, especially if they have a chemical odor about them. When they breathe in your face, you can smell it. It's in their lungs, but it also gets on their clothes, and usually you can smell it if you're thinking about what somebody smells like. A lot of individuals don't want to know. A lot of nurses and doctors. Anyway. Nitrates have been used as medicines, especially heart stimulators for angina, since the 19th century. Alkyl nitrite, isomyl nitrite, butyl nitrite, isobutyl nitrite, isopropyl nitrite, and cyclohexyl nitrite are some of the nitrites that have been used. Nitrates Nitroglycerin, if somebody has a heart attack, you put a nitroglycerin pill underneath their tongue. It takes away the pain and it slows things down. It actually opens up the blood vessels, and that's why it works. Nitrites dilate blood vessels so that organs can receive more blood. This is usually done for the heart during angina attacks or with cyanide poisoning. It takes 7 to 10 seconds for the effects to take place and lasts for 60 to 70 seconds. The blood pressure lowers and hits its apogee at 30 seconds and returns to normal at about 90 seconds. Nitrites are sometimes called poppers. Nitrites cause a feeling of fullness in the head, rush, mild euphoria, dizziness, and giddiness. As the inhalant burns off, they might experience headache, nausea, vomiting, and chills. Excessive abuse may cause oxygen deprivation, fainting or passing out, temporary asphyxiation. Overdoses do occur and necessitate taking the victim away from the nitrite. CPR might be necessary to maintain heart rhythm and respiration. Chronic users will have a reduced oxygen carrying capacity due to methemoglobin. Nitrites are used to enhance sexual activity by increasing blood flow to sexual parts and relaxation of smooth muscles. This is especially necessary when the anal sphincter requires relaxation during anal intercourse. Unfortunately, nitrites impair the immune system by inhibiting the functioning of white cells. Nitrites also convert nitrosamines, which are cancer-causing chemicals. Poppers, when used with Viagra, cause lowered blood pressure in users since both medications lower your blood pressure. When these two drugs are used with methamphetamine, people have been known to faint or even die. Volatile nitrite abusers are notorious for multiple drug use. 2/3 use at least 3 other inhalants. 1/3 abuse alcohol. 1/3 abuse drugs other than inhalants. Anesthetics are used to slow the central nervous system and stop pain from reaching the brain. Anesthetics also cause euphoric effects when abused. One of the first anesthetics to be used was nitrous oxide. Recently, nitrous oxide has been abused along with ecstasy to accelerate the rush and to enhance the effects. Nitrous oxide is sold in small plastic containers to be used in cooking. Nitrous oxide's effects include dizziness, giddiness, and disorientation, silly laughter, buzzing and throbbing in the ears, visual hallucinations, confusion and headache, feeling that one is about to pass out, impaired motor skills, and fainting. The effects only last 2 to 3 minutes. Cognitive functioning is impaired with the drug, but returns to normal after about 5 minutes. Long-term exposure can cause peripheral and central nerve cell damage due to lack of oxygen. Nitrous oxide replaces oxygen in the blood. Long-term exposure will lead to loss of balance, loss of dexterity, overall weakness, numbness in the arms and the legs, cardiac arrhythmias, asphyxia, seizures, and potentially death. There we go. Ooh, he's feeling pretty good. And there, he grabbed it again. Okay. Halothane is rarely used in the West. It is widely used in third world countries because it is inexpensive and works very rapidly. This anesthetic is used primarily in veterinary procedures. It is most frequently abused by hospital personnel. Inhalants cause less physical and psychological dependence than other depressants. Inhalants cause cognitive impairments that hinder comprehension and recovery. Inhalants will sometimes cause a cross-tolerance to other depressants, especially alcohol if used chronically. Inhalants are seen as low class among the drug-using community. 3 categories of drugs used in sports: therapeutic drugs used for specific medical problems and administered through proper medical supervision, analgesics, that's painkillers, muscle relaxants, anti-inflammatories, and asthma medication. Ergogenic drugs, performance-enhancing drugs that people use, steroids, human growth hormone, blood doping, and stimulants. Recreational and mood-altering drugs, that's just what we talked about in the previous 6 chapters. Is that right? Are we on chapter 7? Yeah, we're on chapter 7. Okay. Athletes use drugs because they perceive drugs as a quick way to put on pounds and muscle, increase stamina, get up for a game, relieve pain, and to keep up with other athletes who use drugs. Analgesics and anesthetics are used to deaden pain and include both topical, the alcohols ethanol and methanol, procaine and lidocaine, oral, aspirin, ibuprofen, acetaminophen, hydrocodone, also known as Vicodin, meperidine, also known as Demerol, morphine, codeine, and propoxyphene, also known as Darvon. The biggest problem with analgesics and anesthetics is that they take away the pain without repairing the damage. And so if you are exercising more, you may do damage to your joints or to your muscles and not know it because you have taken away the pain. The pain is there for a reason. The pain is to tell you that you are damaging something. And of course, if you haven't had an analgesic, then you know to stop. But if you've taken an analgesic and then go out and exercise, the probability that you will do damage is fairly high. Muscle relaxants are drugs that depress the neural activity within skeletal muscles and are used to treat muscle strains, ligament strains, muscle spasms, tremors, or shaking. Cariprazole, also known as Soma and Vanadom, methocarbamol, also known as Robaxin, and the benzodiazepines, diazepam, also known as Valium, clonazepam, also known as Klonopin, and chlordiazepoxide, which is also known as Librium. Anti-inflammatory drugs lessen pain as well as control inflammation. These drugs come in two classes: non-steroidal anti-inflammatory drugs, also known as NSAIDs. That would include aspirin, ibuprofen, indomethacin, also known as Indocin, phenylbutazone, also known as butazolidine, Sulindac, Clinoral, and celecoxib, which is also known as Celebrex. Corticosteroids, prednisone, and cortisone are also anti-inflammatories. Both types of anti-inflammatories have their problems. NSAIDs, aspirin, and ibuprofen cause ulcers and kidney problems. Celebrex is only recommended for arthritis and may cause heart and gastrointestinal problems. Corticosteroids can cause water retention, bone thinning, muscle and tendon weakness, delayed skin healing, vertigo, headaches, glaucoma, psychosis at high doses, and that, of course, is dangerous. Golden Knights, is that what the shirt says? Yeah, the Hokies. Golden, well, anyway. Asthma medications open air passages. 10% of general population has asthma. 10%, 1 out of every 10 people have asthma. Asthma is often aggravated by heavy exercise and stress. Exercise-induced asthma occurs in 11 to 23% of athletes. Most asthma medications used by athletes are beta-2 agonists, clenbuterol, which is banned during competition, and albuterol. These medications increase muscle energy and growth. Ergogenic drugs include anabolic steroids, stimulants, human growth hormone, pre-steroids, beta blockers, erythropoietin. Ergogenic techniques include blood doping, soda doping, herbal medicines, and weight loss. And these guys have been using steroids. Wow, them some pretty big boys. Anabolic steroids are synthetic androgens and are used for muscle building and muscle repair. These drugs are used routinely in medicine to treat testosterone insufficiency, delayed puberty, wasting diseases, osteoporosis, certain types of anemias, some breast cancers, and endometriosis. When athletes take steroids, they experience increased body weight, lean muscle mass, muscular strength, stamina, aggressiveness, and confidence. Athletes taking anabolic steroids will take 20 to 200 times the prescribed daily dosage. Anabolic steroid users will use the drugs in from 4 to 18-week cycles. This is done to give the body a chance to recover from the drug use or to escape detection of use. Cycling steroids usually involves using more than one kind of drug. 82% of cyclers cycle 3 or more different steroids at a time. 30% will use 7 or more steroids at a time. Immediate effects of steroid use and increased muscle mass and improved muscle tone. Having muscle too large and strong for the bone and tendon structure may cause an overstressing of the muscle, which can potentially rupture tendons or damage ligaments. Users often complain of feeling bloated, they do have water retention to some extent. That's why their muscles look so large. Anabolic steroids suppress the natural production of testosterone. It causes enlarged breasts, nipple changes, decreased size of the sexual organs, impaired sexual function, cystic acne growth, thinning hair, and more rapid balding. And this is what cystic acne growth looks like. There you go. Female, oh, he's pretty big. One of the things that you should know about this guy, why he looks different from this guy and this guy and these guys. Why do they look so different? This guy is in competition, and what he has done, he's taken a diuretic and he's drawn off all the excess water from his system, and that's why his skin, there's no water underneath his skin, and for that reason he looks more ripped than these other guys do. See, they're equally as strong, but this guy's not as ripped as the other guy, or this guy's not as ripped as the guy we were looking at before. And these guys. Why? Because they have water underneath their muscles, or on top of their muscles, and underneath their skin. So if they were in a competition, one of the things they would do would be to draw off all that water. Now remember, water retention is one of the side effects of taking steroids. And he has taken diuretics to get rid of all that excess water. Female athletes also use anabolic steroids for muscle growth and other masculinizing effects, though some are unwanted. It increases your facial hair, it decreases your breast size, lowers your voice, clitoral enlargement, cystic acne growth, just like the guys, and thinning hair, which is always attractive. Most of these masculinizing effects are irreversible. So once you start taking steroids, all of these things occur and there's nothing you can do to reverse the situation. And there's a young lady. This is what she looked before. This is what she looked like in competition. And there's another young lady. That's what she looked like before. And that's what she looked like in competition. And well, I don't know, this one's not competing, but this is what she looked like before. And she looks kind of anorexic to me. And there you go. Well, she's in pretty good shape, but look at that. She's much, much larger. And there you go. This is what she looked like before. And this is what she looked like on steroids. Same lady. Anabolic steroids increase the cholesterol of the user, especially the bad cholesterol, the LDL. At the same time, steroids lower the good cholesterol, or HDL. Steroid users have an uncommon amount of cardiovascular problems. They tend to have hypertension, thrombosis, and cardiomyopathy. I had a friend who just died last year. I sent him a Christmas card, and it came back because he had passed away. Anyway, this guy had a real serious problem with varicose veins in his legs, and it's a form of thrombosis. What happens is you get a blood clot in your leg, in your veins. Usually, it's the smaller veins on the outside of your skin, or right under your skin, and they clog up and they become blocked. Well, it's from thrombosis. A lot of people have varicose veins naturally, but people who are steroid users, their varicose veins tend to be a little bit more severe. This guy had a real serious problem with varicose veins. and he died last year. He had just turned 60, and he died of AIDS, actually. Because steroids encourage cell growth, they may equally encourage cancer cell growth, and of course, this is a problem. Anabolic steroids do have an impact on the user's mental state, at first supporting more aggressive and confident behavior. As use continues, confidence swings to aggressiveness, to emotional instability, to rage, to hypomania, to depression, to psychotic symptoms, to paranoia. This emotional cycling is known as roid rage and is more pronounced in individuals who have anger issues before taking the steroids. While some people report a slight euphoria when taking anabolic steroids, it is thought by researchers that this is due to anticipation of intense activity rather than actual addiction. Some users do report withdrawal symptoms, and in fact, some users will use low doses during cycling to maintain sanity. There is some animal study evidence that steroid use is addictive. Stimulants are taken by athletes to make them more alert, to make them feel more confident, and to make them stronger. Much of the increase in ability when taking amphetamines is increased focus and aggressiveness. Heavy usage can lead to blood pressure problems, exhaustion, and malnutrition. Caffeine is a mild stimulant used by some athletes. At low doses, it increases your wakefulness, your mental alertness, it slightly increases your endurance, it increases your muscle contraction, digestive disturbances, and urine output causing dehydration. Ephedra, or also known as mahuang, and ephedrine are mild stimulants used by some athletes. These substances are found in many over-the-counter medicines. Not everyone is sensitive to these medications, but to those who are, they cause jitteriness, anxiety, headaches, high blood pressure, cardiac arrhythmia, poor digestion, and overheating. This is an individual that was pitching for the Cleveland Indians. He was on ephedra, and he overheated and died on the baseball field. And I can't remember his name. This was about 20 years ago that the individual died. Chewing tobacco used to be a mainstay in Major League Baseball parks. From the beginning of baseball until into the 1980s, many, if not most, baseball players maintained a chaw of tobacco in their cheeks almost constantly during a game. Many baseball icons of the past died of throat or esophageal cancer. It is rarely seen today because it has been outlawed by Major League Baseball. And this is Nellie Fox, played second base for the Chicago White Sox when they won the pennant in 1959, and he died of esophageal cancer. This is Pablo Sandoval, used to play for the Giants, played for the Boston Red Sox, played for the Braves the year they won the World Series, and they won just recently. He used to chew tobacco, but he's out of baseball now. Well, actually, he plays baseball in Mexico, I believe. Human growth hormone is a hormone produced by the pituitary gland to stimulate growth in children. It is prescribed for children who are of unusually small stature to stimulate growth, and for people with wasting diseases like AIDS to build up their strength. It is used by athletes because it increases muscle mass, skin thickness, connective tissues in muscles, acromegaly, cardiovascular disease, decreased sexual desire, goiter, menstrual disorders, and impotence. Decreases your lifespan up to 20 years. I'm trying to think of what this guy's name is. He won the most valuable player for the Brewers. He was the most valuable player in the National League. I can't think of his name. It's escaping me. Anyway, the next year he was. They found human growth hormone in his system. So the year after he was MVP, he was banned from baseball for like the first half of the season. Can't think of his name. Might come to me. This is what acromegaly looks like. It's an elongated, lowered ears, elongated face, elongated hands. It is thought that Abraham Lincoln was suffering from acromegaly, and that he probably wouldn't have survived very much longer if he hadn't been assassinated by John Wilkes Booth. Ryan Braun, that's his name, Ryan Braun. He has retired from baseball now. Androstenedione, or also known as andro, and dehydroepiandrosterone, also known as DHEA, are natural hormone precursors to testosterone. Neither of these supplements have been found to do more than increase testosterone levels in men with abnormally low testosterone levels. They also seem to increase HDLs and the female hormone estradiol, which makes it sound like if you take these, that you will, since it increases your estradiol level, it will make you more feminine. If you don't have an abnormally low testosterone level, they actually won't do anything to you. Only if you have a low one, as weird as that is. Beta blockers are medications prescribed to lower blood pressure, decrease heart rate, prevent arrhythmias, reduce eye pressure. They work by blocking adrenaline from exciting the heart. They also calm the individual by blocking nerve cells in the brain. Beta blockers are used by athletes who require precision and concentration, such as archers, participants in rifle shooting competitions, ski jumpers, and divers. Beta blockers do have their problems as they cause fatigue, lethargy, dangerously low blood pressure, gastritis, occasional nausea, vomiting, temporary impotence. It may intensify asthma. It may intensify heart problems that may kill the user. Erythropoietin, or EPO, is a medication that is given to individuals to promote red blood cell production. My sister was suffering from cancer, and she would become anemic after a while. She was in treatment, and they would give her EPO to increase her red blood cells. It is often given to individuals who are going through chemotherapy, as she was, to induce their bone marrow to produce replacement RBCs due to their problem. EPO is used by athletes to increase stamina, though the unnatural thickening of the blood can lead to blood clots, which in turn might lead to strokes or heart attacks. And this is a really serious problem. People that require stamina, like cyclists and marathoners, will sometimes they'll take EPO. We have a way of checking this so we can look at their blood and determine whether they have a natural or unnatural level of EPO in their system. A similar problem is blood doping, where the athlete stores their own blood prior to competition and then are administered the packed red blood cells to increase the stamina of the individual. This technique is used in endurance sports such as cycling, long distance running, and cross-country skiing. As silly as this sounds. Your blood's only good for about 30 days. After that, the red blood cells are too old to administer to anybody. So you have to actually draw off this unit of blood about 10 or 15 days before they actually do the doping. So, and then they concentrate, they pull out all the serum, and then they will administer just the red blood cells. And like I said before, it can cause thickening of the blood, which can lead to strokes and thrombosis, blood clots. Oops, going the wrong way. Athletes will use just about any substance that will give them a competitive edge. Herbs, animal extracts, vitamins, minerals, proteins. Unfortunately, some of these items may contain banned chemicals and cause the athlete a great deal of trouble. One dietary supplement used by athletes is creatine. Creatine is an amino acid that occurs naturally in the human body as well as in fish and meats. Creatine is used because it delays muscle fatigue. It stores energy that can be used in short bursts. It extends the amount of time a person can work out. It helps muscles recover faster. Problems come when it is overused, causes dehydration, stomach cramps, nausea and diarrhea, muscle pulls and strains, and kidney problems. And this is a guy who's taking creatine, That's what he looked like on day 1, and this is what he looked like on day 6. As you can see, his biceps are bigger, his deltoids are bigger. That's all we can really see, I guess. Gamma hydroxybutyrate, or GHB, was used in the 1980s and early 1990s as a fat burner, as an anabolic agent, as a sleep aid, as a muscle definer, as plant growth supplement, and as a psychedelic. Picked up by sexual predators as a date rape drug, it is now only used legally as a medication for muscle weakness. And here's a guy. There he goes. He's putting his drugs into somebody's drink, hoping that the right person picks it up. Some athletes will consume sodium bicarbonate 30 minutes prior to exercising to decrease the development of acidosis. This works for shorter events that take place within 10 minutes, but not for longer endurance events. It can cause diarrhea and water retention, which makes you not feel good. Athletes trying to make weight will resort to various techniques to drop unwanted pounds. Diuretics, laxatives, exercise, fasting, self-induced vomiting, excessive sweating in the sauna, stimulants. Some athletes will lose 3 to 5% of their body weight in a couple of days. Wrestlers do this, especially wrestlers. They have to make weight, or boxers. Anorexia and bulimia are not uncommon among athletes who are potentially trying to make unrealistic weight levels. Another problem with weight maintenance is the opposite of anorexia, muscle dysmorphia, where the individual becomes obsessed with muscle development as they see themselves as too weak whenever they look in the mirror. These individuals are more likely to take copious supplements and steroids to combat their body's weaknesses. Athletes will often use diuretics to lose weight rapidly, to limit the bloating caused by steroids, by sucking the water out of their system to avoid detection of illegal drugs, to lose weight, to look thinner. Athletes need to monitor their use of diuretics because of the possibility of dehydration leading to heat stroke and organ damage. Weightlifters will take adrenaline supplements combined with amyl or isobutyl nitrite to increase strength. It unfortunately can cause dizziness, rapid heartbeat, and hypertension. Bee pollen is sometimes taken as a supplement, a way of boosting energy levels, digestion, and reduce stress. Studies do not support any benefits from bee pollen. Some athletes will take calcium pangamate as a supplement. This chemical combination is sometimes referred to as vitamin B15 and pangamic acid. It is refuted to keep muscle tissue better oxygenated, though there is no scientific research to back up the claim. The substance is a known carcinogen, which is a good reason not to take it. Cyproheptadine periactin is reputed to be a steroid-like bodybuilder and has been used to increase body weight and muscle strength. This drug is an antihistamine. It acts as a serotonin and histamine antagonist. It increases muscle mass and strength by making the individual hungry. It actually merely increases the user's appetite and has the added side effects of decreased performance, sweating, and sedation. Darbepoetin aranesp is a medication developed to treat chronic anemia. Just like erythropoietin, the drug increases RBCs and thus the oxygen carrying capacity of the athlete's blood. Human chorionic gonadotropin is the substance produced by fetuses to protect themselves from their mother's immune system. HCG, along with clomiphene or tamoxifen, is taken by steroid users to restart their own body's testosterone production. The substance also blocks the increased effects of estrogen in the male body. The drug can have an impact on the liver and reproductive system. HCG, so if you've ever had a pregnancy test or been around somebody taking a pregnancy test, what they were measuring was human chorionic gonadotropin. That's how they determine if you're pregnant. Modafinil, Provigil, acts as a stimulant and is used to treat narcolepsy. Athletes using the steroid THG will take the drug to mask the steroid. Ornithine and arginine are amino acids taken to increase muscle mass because it is reputed that they cause an abnormal release of HGH, human growth hormone. Permogen is used in Europe to facilitate the release of steroids in the body. Vitamin B12 is used to ward off illnesses and provide extra energy. It can also be used to speed the recovery from a hangover. When I was working in the rural health clinic in Oklahoma, people used to come in for a vitamin B12 shot if they had a bad night and they were suffering from hangover. And doggone it, it wasn't Saturday or Sunday. Sometimes they come in on Saturday. As has been seen, athletes will do just about anything to take just about anything to improve their performance on the athletic field. Athletes will use stimulants to boost their performance, from innocuous caffeine and tobacco to more destructive amphetamines. Athletes will use sedative hypnotics, especially Xanax, to unwind from the stresses of competition. Sometimes these drugs are used to counteract the stimulants they have taken to perform. The most widely used depressant by athletes is alcohol. When in low doses, the substance does not hinder performance. In most cases, alcohol is used as a reward for performance, as a way to unwind, or as a consolation after a disappointment. Marijuana is contraindicated for performance, though when used in the right mood, might actually improve performance. Marijuana doesn't help athletes because it lowers your blood pressure, causing fainting during competition. It inhibits sweating, which might lead to heat prostration during exercise. It decreases your tracking ability. It hinders the ability to do complex tasks. It diminishes hand-eye coordination. It decreases oxygen intake. It is a banned substance by the NCAA. It is illegal in 36 of 50 states. Actually, it's only illegal in 20 out of 50 states now. Because marijuana is fat-soluble, it continues to impair 1 to 2 days after its use. There are no limits to what people will do to get high. People have been known to smoke aspirin, to chew dandelion roots, to drink gasoline. Individuals have been known to mix gasoline with orange juice to make a barely palatable concoction known as Montana gin. Drink rubbing alcohol, drink hydrogen peroxide, put Anbesol, which is a topical anesthetic, in their eyes, smoke toad secretions. Mortuaries have had to watch their supplies of the fluid they use to embalm bodies, formaldehyde. When inhaled, the substance acts as a depressant and a psychedelic, but can also be used to manufacture illicit drugs. When mixed with marijuana, the substance provides a PCP-like effect and is called clickers, clickums, fry, wet, or illy. Raid, Lysol, and any hairspray are sometimes used for their alcoholic content. Raid has been used to spray on marijuana to intensify the effects of the marijuana in a concoction known as Cannade. Kava is a plant found in the South Pacific and South America. The root is crushed and a milky white exudate is extracted, which is drunk like alcohol. The drink is reputed to have a similar effects as alcohol and acts as an anti-anxiety drug. It is said to have an unpleasant flavor and numbs the tongue and lips. Human saliva is used in its preparation. In some Arab countries, camels are force-fed marijuana. After going through the digestive process, the camel dung is smoked for its hashish content. The bufo genus of toads, the Colorado river toad, produces a psychedelic substance from its pores as a defense mechanism from attacks. This is what the guy looked like. The toads are sometimes milked and resulting substances smeared on cigarettes and smoked for their psychedelic effects. All natural medications started out as herbal preparations concocted by shamans, medicine men, wizards, or physicians. Some of these herbs merely have had a placebo effect, while others have been proven to contain chemical structures that have great benefits for mankind. For example, quinine was developed from the cinchona tree to fight malaria. The search for the fountain of youth, or merely drugs that will help the individual recover from a hard night of drinking, have recently come to the fore as smart drugs or drinks and nootropics. Smart drugs or drinks and nootropics are drugs, nutrients, vitamins, extracts, herbal potions, ginseng, ginkgo biloba, caffeine, and amino acids. Now, I have to tell you right now that I do take ginseng and ginkgo biloba every day to increase the blood flow to my brain. My idea is that, doggone it, I couldn't think of Ryan Braun's name just a minute ago, so I need to increase the blood flow into my brain, and that's ginseng and ginkgo biloba. Are supposed to do both of those things. These drugs are reputed to boost intelligence, improve memory, sharpen attention, increase concentration, detoxify the body, energize the user, reverse the aging process. New age smart drugs or nootropics include hydrogene, selagelene, vasopressin, 5-HT, modafinil, paracetam, oxyrocetam. They're supposed to improve your learning, improve your memory consolidation, and improve your memory retrieval. And I would tell you, why do you need these drugs? Just stop smoking pot, which messes your memory up, or drinking alcohol. Compulsive disorders are repetitive behaviors that the individual appears not to have any control over. They come in two categories: impulse control disorders, such as compulsive gambling and hair pulling; compulsive disorders that have their own classification: overeating, shopping, sexual behavior, internet use, watching television, pathological lying, shoplifting, and fire setting. And this lady is a hair puller. Impulse control disorders are actions that may be pleasurable in the beginning, but as the attempt to resist the impulse continues, becomes harmful to the individual or others. This disorder also has accompanying tension or arousal before the act is committed. After culmination of the act, the individual often feels gratification, pleasure, relief, and then possibly remorse and guilt for not controlling the behavior. Obsessive-compulsive disorder is a repetitive activity where the goal is to reduce anxiety or distress caused by obsessive thoughts. The goal is rarely to provide pleasure or gratification and include compulsive hand-washing, checking things, ordering, counting, and praying. Compulsive behaviors are engaged in for the same reason people compulsively use addictive drugs: instant rush, forget problems, control anxiety, oblige friends, and self-medicate. These individuals are trying to alter their mood and change their state of consciousness. MRIs show that the same areas of the brain are activated when compulsive behavior is done as when drug use is anticipated or done. Compulsive behaviors, the drug users, they are compulsive about their drug use. The compulsive gambler, they are compulsive about their gambling. The drug user develops a tolerance to their drug. The compulsive gambler increases the bet amount when gambling compulsively. They build up a tolerance as well. The drug user has withdrawal symptoms after abstinence. The compulsive gambler becomes restless when not gambling. They also have withdrawals. The drug users continue to use despite adverse consequences. The compulsive gambler continues gambling until they have used all their money, and of course that is another form of abuse. When you think of compulsive gamblers, it's not like they come off a big win and have a pocket full of cash. Usually they will gamble until all their money is gone, whether they win or lose. The compulsive drug user are in denial about their usage. The compulsive gambler thinks they control their gambling and refuses to see the consequences. The compulsive drug users have a strong tendency to relapse. And of course, the compulsive gambler will relapse whenever they have money again. They feel the need to give it to somebody at the casino. One telling sign is that organizations like Gamblers Anonymous and Overeaters Anonymous use a 12-step program identical to the 12-step program set up by Alcoholics Anonymous. Addictive behavior involves a lack of individual control, and these organizations demonstrate the necessity to change their lifestyle and beliefs. Compulsive behavior can be triggered by various factors: genetic predisposition, environmental stress, the repetitive behavior itself. Substance abusers, compulsive gamblers, compulsive overeaters, and compulsive shoppers all show the same dopamine increase in the brain. Compulsive behavior does seem to run in families. Binge overeating has been shown to have a relationship with overactive 5-HT serotonin receptors. Twin studies support the strength of genetic factors leading to obesity. These connections were stronger than shared environmental pressures. Studies of adopted children supported the strength of genetic influences where such environmental factors as frequency and volume of meals, amount of snack food in the house, and level of exercise was less significant than heredity toward obesity. Researchers have found a marker gene that shows a strong proclivity for addictive behavior, especially alcoholism, DRD2A1 allele. It appears in only 19 to 21% of non-alcoholics, 69% of severe alcoholics, 45% of compulsive overeaters, 48% of smokers, 52% of cocaine addicts, 51% of pathological gamblers, 76% of pathological gamblers with drug problems, 45% of people with Tourette's syndrome, and 49% of children with ADHD. But in non-alcoholics, 19 to 21%. It is speculated that these individuals who have the DRD2A1 allele gene have a deficiency of dopamine receptor sites and therefore must seek excessive stimulation to force extra dopamine to be released in the reward reinforcement pathway to feel normal. Since their normal is less stimulating, they're bored. Stimulation allows them to feel pleasure. Compulsive gambling may be triggered by the plethora of venues to gamble. State lotteries, poker machines, internet betting, legal off-track betting, casinos on every corner. That's especially true in Montana. There seems to be some place to gamble at every gas station. Compulsive overeating may be triggered by the plethora of fast food restaurants, the lack of daily physical activity, fats and sugars in the foods that induce craving, parents overfeeding their children, chaotic childhoods that lead people to use food to relieve their depression. Compulsive sexual activity may be triggered by a plethora of sexual situations depicted on TV, latchkey kids with no supervision, children with no close emotional family connections, and abundance of internet pornography. Compulsive internet use may be triggered by expanding networks of games, massive multiplayer online role-playing games. Dedicated gamers all will play online for an average of 8 hours a day, expanding networks of online gambling, expanding networks of chat rooms. Compulsive shopping may be triggered by the ease of getting credit, a materialistic view of life. It isn't who you are, but what you have. A barrage of advertisements on TV, catalogs, 24-hour home shopping networks, internet shopping, internet auction sites. It has been observed that there is a history of emotional, physical, and sexual abuse in the lives of many of the individuals who suffer from compulsive behaviors. Engaging in the behavior can lead to compulsive behavior. A big payday when gambling. Eater takes in excessive sugars and fats and changes the body's chemistry. Now they eat to be happy. Being able to buy something that the individual wants makes them shop with the anticipation that they will find another coveted item. Participation in ritualized masturbation, compulsive viewing of pornography, or participation in other compulsive sexual behavior will make the individual avoid normal sexual behavior or emotional relationships. Compulsive gambling has skyrocketed in the last decade, with poker tournaments being shown on television and online gambling available. Last year, gambling revenues in the United States topped $75 billion. Last year, gambling revenues worldwide topped $125 billion. Now, this is really kind of interesting because when I was young, until the 1980s, of course, I was born in 1949. Until the 1980s, gambling was illegal everywhere in the United States. Las Vegas, gambling was illegal in Las Vegas. Atlantic City had turned into a tourist destination with no gambling, and Indian gaming was not allowed. It wasn't until Ronald Reagan became president that he allowed uh, the Indian casinos to flourish. Gamblers Anonymous defines gambling as any betting or wait. Don't think about Ronald Reagan as what a hero, because what Ronald Reagan was doing, what he did, he was trying to say that the Indian reservations needed to be closed down, and so instead of he tried to take away the federal status, the autonomy of the indigenous populations in the United States. He tried to give it to the states, and by doing that, he thought he would make the Indian tribes less autonomous, and that was his whole purpose. As a matter of fact, during the Carter administration, Jimmy Carter and Congress authorized this building on the Indian reservations. Um, and when Reagan became president, he took away all the funding for plumbing. So they had built all these houses, all this HUD housing on some of the reservations, and they couldn't put in any toilets or any water. And if that was the same way with the larger buildings, they couldn't put in any plumbing. As weird as that sounds, so don't think of Ronald Reagan as some kind of a hero to American Indians. It just turned out that he was actually trying to take away their federal status when he made it possible for the Indian reservations to have gambling. Gamblers Anonymous defines gambling as any betting or wagering for self or others, whether for money or not, no matter how slight or insignificant, whether the outcome is uncertain or depends upon chance or skill, constitutes gambling. Forms of gambling: casino-style gambling, poker, blackjack, craps, roulette, slot machines, video poker machines, horse and dog track racing, jai alai, which is a game that they play in Florida, bingo and raffles. I've never seen jai alai anyplace except in Florida, especially in Miami. Bingo and raffles, state-run lotteries in Keno, sports betting, both legal and illegal, Super Bowl office pools and betting on golf, schoolyard games, lag pennies and flip coins, bar games like Liar's Dice, stock speculation such as day trading, commodities and options, and internet gambling. Gambling has been around since the dawn of man. Gambling bones have been found in human habitation sites that date back 40,000 years. This was not an old world phenomenon. Mayan digs have found gambling implements that closely resemble the dice and bones of other civilizations. Along with the gambling has come attempts at prohibition. India banned gambling in 1000 BC. During the Roman Empire, it was only for the aristocracy. Louis IX of France in 1255 banned gambling. Henry VIII of England banned gambling. And during the Victorian era in the United States, gambling was banned until 1980, as I told you before. So when I was young, gambling was illegal all over the United States. And if you were caught in a poker game with stakes, where people were actually losing money, you could be arrested and put in jail. Gambling came to the United States with the British, but the corruption and the addictive behavior made the practice unpalatable, and it was banned. While it was banned in the East as people moved across the Mississippi River, gambling was popular in the Wild West. Infected by the same corruption and Victorian morality, by 1910 it again was gone in the West as well. Gambling didn't return until the 1970s. Since then, Atlantic City and Las Vegas have become gambling meccas, and Indian casinos have changed gambling attitudes, bringing in more money than the cities combined. 48 states have some form of gambling. Only Utah and Hawaii do not have legalized gambling. Compulsive gambling, like any other addiction, comes in two forms. Problem gambling, gambling behavior that causes problems in an individual's life, either psychologically, physically, sociologically, or vocationally. And pathological gambling, gambling behavior that is persistent and continual and significantly disrupts all aspects of an individual's life. The real difference between problem and pathological gamblers is often time and money. Problem gamblers can afford to spend as much time and don't have the money to gamble as they want. They average losses of $3,000 per year. A pathological gambler spends far more time gambling and averages losses of $11,000 a year. The average debt for women entering Gamblers Anonymous is $60,000. The average debt for men entering Gamblers Anonymous is $100,000. Studies show that problem and pathological gamblers lose 10 to 20 times as much as non-problem gamblers. In a study in Connecticut, 47% of the casino patrons were problem or pathological gamblers, even though they only comprise 5% of the population. In Minnesota in 1993, it was discovered that 2% of the population generated 63% of the state gambling revenues. Harvard Medical School studies estimated that 125,000 people in the United States gamble. 2,200,000 of these individuals are pathological gamblers. 5,300,000 of these individuals are problem gamblers. This didn't take into account the 1,100,000 adolescent pathological gamblers. Male compulsive gamblers outnumber female compulsive gamblers by 2 to 3 times. This may be changing with the increase of casinos and slot machines, as women are more likely to use gambling to escape depression, trauma, or relationship problems. Pathological gamblers tend to have other addictions. 25 to 63% of pathological gamblers have other behavioral or substance addictions. One study found that 73% of pathological gamblers had alcohol problems. The same study found that 38% of pathological gamblers had a drug problem. 60% smoked, 50% had mood disorders, 41% had anxiety disorders, 60% had personality disorders. The group that has seen the greatest rise of gambling is among older adults. One survey of residential and assisted care facilities found that 16% went to casinos at least once a month. This behavior is exacerbated by casino-sponsored trips and day trips, which were found in 2/3 of the facilities. College students gamble at a higher percentage than any other group. 42% gamble, 26% gamble weekly or more frequently. Heavy college gamblers were more likely to be smokers, heavy drinkers, and or heavy marijuana users. These individuals averaged lower grades and more frequent absences. When I was in college, I was too poor to gamble. That's for sure. I don't know how these guys have enough money to do that. Different types of gamblers, recreational social gamblers, are able to separate gambling from the rest of their lives. For professional gamblers, their main source of income is gambling, and because of this, they are able and willing to take losses in their business. Antisocial gamblers may steal to gamble and have no conscience about the thievery and corruption that they represent. There are two subtypes of pathological and problem gamblers. Action-seeking gamblers are frenetic, excited, and are always seeking to escape. Escape-seeking gamblers are drawn to gambling machines and are often responsible people with good jobs, but they begin gambling to escape from their emotions or just to escape boredom. The symptoms of persistent recurrent pathological gambling: preoccupation with gambling, reliving past gambling experiences, planning future gambling, increasing the amount of money used in gambling, unsuccessful attempts at stopping or curbing gambling, restlessness and irritability when not gambling, using gambling as an escape, chasing, trying to recoup past losses, lying about gambling, financing gambling through illegal acts, jeopardizing job relationships and education to gamble, expecting others to bail out the gambler's debts. Winning phase: in the beginning, the bets are small and they are happy just to win or break even. But as the recreation becomes compulsion, the reward becomes more the stimulation of the action, and they seek to prolong the action as long as they possibly can. Winning becomes secondary to staying in the game. In 70 to 80% of the cases with compulsive gamblers, the beginning of their craving for gambling started with a big win. The gambler begins spending more time wagering, and their conversations are salted with lionizing their wins, and when mentioned, minimizing their losses. The losing phase begins with a losing streak, which is inevitable due to the simple laws of chance. Their large losses are met with larger wages to try to recoup their previous losses, and this is known as chasing. As the gambler continues to lose, they will dip into depression. They will seek isolation, become irritable, and lie about their situation. Desperation phase: in the desperation phase, the pathological gambler may lose their job, max out their credit cards, borrow money from friends and family, perhaps turn to illegal activities to hide their addiction: theft, embezzlement, drug dealing. The gambler may bankrupt their family and suffer divorce. Giving up phase: in the giving up phase, the gambler is no longer trying to recoup their losses, but seeks the game to stay in the action. 72% of gamblers experience depression when they hit bottom. Suicide attempts occurred in 17 to 24% of these gamblers when bottom was hit. This is usually the time when the gambler seeks treatment. For the compulsive gambler, it isn't the money that they are seeking, but the rush from a large win and the zoning out that gambling affords them. About one-third of compulsive gamblers recover on their own, usually triggered by devastating financial losses. For the other two-thirds who seek treatment, the techniques used include antidepressant therapy, anti-craving drugs such as naltrexone, and of course Gamblers Anonymous. Compulsive shoppers and hoarders have the same cravings as do gamblers and drug addicts, but in this the high is caused by the feeling that they get when they purchase an item. 74% of the time, compulsive buyers purchase items on impulse. 50% of the household income for these compulsive shoppers goes to paying their shopping debts. Compulsive shoppers tend to buy items that enhance their sense of uniqueness. Women buy jewelry, clothes, and cosmetics. Men buy high-tech electronics and sporting equipment. Depression seems to be the main impetus behind their compulsive shopping. It seems worse during the winter holidays, so this is the time when they accrue 40% of their debt. Antidepressants reduce their urge to compulsive shop. Collecting, accumulating, and hoarding are offshoots of compulsive shopping. The individuals gain self-worth and self-esteem from the objects that they own. These collectors and hoarders may buy valuable items, contemporary fads, or accumulate valueless items. There are cases of people who are unable to throw newspapers and magazines away. People will also hoard animals, cats, dogs, and birds. In 1980, 15% of the adult population in the United States were considered obese. By 2005, let me talk about hoarders. This is very common in places that have isolated areas, like Montana has less than 1 million people in it, and it's the 4th largest state in the union. Alaska has problem with hoarders. When I was living in Montana, we ran into hoarders who hoarded dogs, hoarders that hoarded horses. There was one guy that hoarded goats. He had over 250 goats on a 20-acre property. And then he died, and the goats all starved to death. All of them starved to death. None of them were recoverable. There was an individual that drove down from Alaska in a semi truck, and they stopped her at the border to see what was in her semi, and in her semi was 112 collies, 112 dogs, and there were a couple that were dead in there, but they pulled all the cages out. They had stacked them up, and these animals had peed and defecated all over each other. It was a real mess. They took them They took them to the state fairgrounds, and they took them. The judge took all the dogs away from the owners. She claimed that she was doing medical research, trying to find collies have some kind of a genetic problem, and she was trying to breed this out of them. That's what she said anyway. But she had 112 of them. They were able to give them away, to give the dogs away. We applied for one, but we didn't get one. I guess we were not good enough to own one of the collies. Anyway, yeah, it was just ugly. I mean, just really ugly stuff. There was another hoarder that had birds, had canaries. Um, uh, I used to show a video of a lady that hoarded cats. When I was working in Omaha, there was a lawyer that would come to she was a lawyer, and she would come to court, and sometimes the judge would make her leave because she smelled like cat urine. And what had happened, what she did, she was a hoarder, and she hoarded newspapers and magazines, and she had a house full of cats, and they would urinate all. And she didn't have any boxes. They would urinate wherever, and they would defecate wherever. And this lady smelled really bad, but she didn't even notice it. She smelled like ammonia, is what she smelled like. Anyway, one night, one of the stacks of newspapers fell on her, and she broke her leg, and we had to go in and get her. Oh, talk about a mess. She was a path person. There was just this tiny path, and here we are. We're trying to get in there with a litter to get her out, and of course it couldn't take a gurney in there. There wasn't enough room, so we had to take uh, we had to carry her out on a litter. It was just a mess. Uh, we had to we had to secure her to the litter and then hold her sideways because we couldn't. It was too wide to take her out that way. It was just a mess, and it smelled. Many Christmas! I stunk like cat urine all night long. It was horrible. Anyway, okay, let's talk about being overweight. In 1980, 15% of the adult population in the United States were considered obese. By 2005, 33% of the adult U.S. population were considered obese. Tragically, only 33% of the adult population are of normal weight. The average height of the United States female is 5'4" with a weight of 164 pounds. The average model in the United States is 5'9" with a weight of 110 pounds. So they don't look the same. This is somebody that is 5'4" and weighs 164 pounds. This is somebody that is 5'9". Is that what 5'9"? Yeah, 5'9", weighs 110 pounds. This is the normal size. This is what a normal person in the United States looks like, not this. Same thing. 5'4", weighs 164 pounds. This you can see. And a lot of people talk about thigh gaps for women. It means that they're skinny enough. And you can see this lady, when she puts her knees together, there's a gap between her thighs. Same way with this lady. There's a gap between her thighs, the thigh gap. I can assure you this young lady doesn't have one. Same thing, 5'4", 164 pounds. And then we have very slender lady. There are 3 eating disorders: anorexia nervosa, with a body image distortion and an addiction to lose weight; bulimia nervosa, eating excessive amounts of food and then controlling weight by purging, vomiting, fasting, or excessive exercise; and binge eating disorder, eating excessive amounts of food with no attempt at weight control. And that's what this individual's problem is. He has binge eating disorder. Compulsive eaters feel powerless when dealing with food. These individuals tend to be obsessed with food. They use food to escape undesirable feelings such as boredom or depression. They tend to have secretive behavior like eating in the bathroom, not where I would want to eat. Guilt or denial, continued overeating behavior despite the harm that they are doing to themselves. Eating disorders seem to be a combination of genetic, neurochemical, psychological development, and sociocultural factors. 0.3% of the U.S. adult population is diabetic. That's 9,300,000 people. 26% of the U.S. adult population are at risk for diabetes. That's 54 million people. 15.5% of American Indian adults has diabetes. 10% of African American adults has diabetes. 6.5% of Mexican American adults has diabetes. 5.6% of white adults has diabetes. It is not uncommon for someone with an eating disorder to have a co-occurring disorder as well. 12 to 18% of anorexics abuse tobacco, alcohol, amphetamines, prescription drugs, or over-the-counter substances. 30 to 70% of bulimics abuse tobacco, alcohol, amphetamines, prescription drugs, or over-the-counter substances. And there's a reason why I have a picture of Kaley Cuoco here. Kaley Cuoco was addicted to, wait a minute, it was a nasal spray, Afrin. It's a nasal spray to open up your nasal passages. She didn't like the way that her voice sounded when she had congestion. So she would use Afrin. Afrin was developed by the United States Air Force for their pilots, so that if they had any congestion at all, of course, if you're flying in an airplane and you're pulling G's and you've got oxygen blowing in your face, if you have congestion, then potentially you might pass out. So if you had congestion, then you couldn't fly. Well, they developed this substance called Afrin, and Afrin opens up your nasal passages, and it does a really great job. You can't use it every day. If you use it every day, it gives you a bloody nose. It it makes the inside of your nose raw. It's that strong. But Kaley Cuoco, was using this, especially at the first, when she was on Big Bang Theory, the first 2 or 3 years, she was addicted to this stuff. And that's the reason I have a picture of Ms. Cuoco. She's not Ms. Cuoco anymore. I think she got married. I think she's pregnant. Anyway, most eating disorders begin during adolescence. They tend to be chronic and affect women more than men. 3% of women suffer from one of the 3 eating disorders. In high school, 33% of girls and 16% of boys show symptoms of one of the eating disorders. And this is Snooki. I can't remember her last name. I think she's married now. This is what she looked like in high school. And as you can see, she's fairly anorexic. Later on, she gained weight for her television show, Jersey Shore. And this is what she looked like after the show ended. She decided that she didn't want to look like this anymore. She thought she looked too fat. So she went on a diet and became anorexic. But she had a history of anorexia because this is what she looked like before, when she was in high school. One of the frightening statistics dealing with anorexics is the age of the onset that has dropped from 13 years to 9 years old. Third grade girls are starting to diet and starve themselves to look thin. Anorexics seem to have a fear of gaining weight. These individuals tend to have a tendency to perfectionism and a low self-esteem. Death rates from anorexia range from 4 to 20%. It is the most deadly mental illness. You can't see her thigh gap. You can see this young lady's thigh gap, though. That's just amazing. Bulimia nervosa is a disorder characterized by binge eating and the obsessively ridding oneself of the food that has been eaten, either through vomiting, laxatives, diuretics, or excessive exercise. Bulimia actually means ox hunger, as in hungry enough to eat an ox. When binging, these individuals eat as if they were famished to the point of uncomfortably distending their stomachs. These individuals are notorious for eating and purging in secret. A bulimic will often have secret stashes of forbidden food stashed away throughout their house that they can eat in private and purge quickly. Much of the cause of bulimia in particular, and eating disorders in general, stems from perceptions of acceptable appearance for females on television. When television was introduced to Fiji, 3% of women on the island vomited to stay slender. 3 years later, the percentage of vomiters was 15%. Fashion models maintain a body weight 13 to 19% below that of women they are modeling the clothes for. And as you can see, this young lady is certainly bulimic. is anorexic. While binging and purging may occur millions of times a week around the United States, it is not without its negative effects. It causes dental complications from the acid content of your stomach, a greater possibility of alcohol abuse, greater possibility of drug abuse, high rate of depression, greater risk of suicide, stomach acid burns to the esophagus and throat, loss of tooth enamel, heart problems, especially arrhythmias, menstrual problems, and electrolyte imbalances. Binge eating disorder has become an international problem. For the first time in the history of humanity, there are as many people in the world who are overweight as those who are underweight. In the United States, where obesity is defined as more than 30 pounds over one's ideal weight, obesity has increased from 15% in 1980 to 33% in 2005. And this is a lady who was suffering from binge eating disorder. This is what she looked like after she was able to stop her binge eating. Binge eating disorder affects 4.6% of the population at large. Binge eating is eating until the individual is uncomfortably full. People tend to be eating in response to emotional states rather than to true hunger signals. These individuals tend to have frequent episodes of eating large quantities of food, feeling a lack of control where food is concerned, eating rapidly and swallowing food without chewing, eating despite being uncomfortably full, eating when not feeling hungry, eating away from others so that they won't see your volume of intake, feeling disgusted because of the lack of control of food, having a preference for high carbohydrates and foods with high fat content, also known as junk food. Binge and compulsive eaters do not seem to know how to pace themselves, eating rapidly and in massive amounts until they feel painfully uncomfortable. Such eating may be done to control anxiety. Food seems to have a calming and sedating effect on some people. Adolescents who eat when they are depressed are twice as likely to suffer from obesity or bulimia. They are also twice as likely to suffer from anxiety or anorexia. Compulsive overeaters are more likely to suffer from high blood pressure, high cholesterol, circulatory problems, heart disease, type 2 diabetes. 15 million Americans have type 2 diabetes. Sleep apnea, gallbladder disease, gout, arthritis, 15 to 60% greater risk of cancer, exhibit high rates of depression, become distressed and develop a negative body image, allow their self-esteem to suffer badly. Sexual addiction is marked by sexual behavior that the individual has little control over and little choice. This type of behavior might be practiced by young or old, gay or straight, and male or female. The addiction not only includes sexual contact with another individual, but arousal through masturbation, viewing pornography, serial affairs, phone sex, visits to topless bars, visits to strip shows. Sometimes sexual addiction can involve illegal activity such as prostitution, sexual harassment, sexual abuse, exhibitionism, which is what he's doing, child molestation, rape, or incest. By 2007, there were over 4 million pornographic sites on the internet. 40 million Americans visit these sites regularly. 70% of the visits are during work hours. 10% of the people surfing the porno sites are addicted to online pornography and spend up to 8 hours a day viewing sexual material. Worldwide, the pornography industry clears $57 billion a year. In the United States, the pornographic industry clears $12 billion a year. Much of the pornography is filmed and photographed in San Fernando Valley outside of Los Angeles. 3 to 6% of the U.S. population are sex addicts. 80% of the sex addicts are male. There's a shock for you. Sexual addiction usually starts in the teen years and then peaks between ages 20 to 40, after which it slowly declines. Sexual addicts seem to suffer from other addictions in conjunction with their sexual problem. The DSM-5 identifies several paraphilias: exhibitionism, fetishism, Freudturism, which is rubbing on other people, like in a subway, rubbing against somebody, Pedophilia, which is wanting to have sex with underage individuals. Sexual masochism, sexual sadism, transvestic fetishism, which is dressing in the opposite sex clothing, and voyeurism, and that is what is going on here. He is watching her undress. That is known as voyeurism. Other sexual addictions include love addiction, the desire to fall in love and be in love; relationship addiction, the need to be in a relationship with an individual. It may mean maintaining multiple relationships at any one time. Individuals suffering from any sexual addiction maintain little, if any, control over their behavior despite adverse consequences. The individual will continue to obsess over the behavior to the distraction of everything else. Compulsive sexual behavior is repeated because of the release of the pleasure-inducing neurotransmitters dopamine, enkephalin, and endorphin. Tolerance to these neurotransmitters leads to a need for the addict to spend more and more time in their sexual activity to gain the same mental benefits. Damage can be done to careers, relationships, self-image, and peace of mind. The sexual addiction becomes a driving force in the addict's life. Part of the drive for the addict may be the risk that they are taking to achieve their target behavior. Usually, the addict will culminate the behavior through orgasm, though in some cases it may involve exposure or fondling. The trigger behavior is often followed by remorse, guilt, fear of discovery, resolution to stop the behavior. The sexual behavior is often pursued with a sense of desperation, self-loathing, despair, and low self-image. Internet addicts seem to have no control over their need to log on. While the internet didn't really begin until 1993, today 4.5 billion people worldwide out of 7 billion people, actually we just passed into 8 billion people just recently, are connected to the internet. 15 to 20% of 1 billion have high-speed connections. In Canada and the United States, 90% of the populations are connected to the internet. The three main uses of the internet are gaming, seeking erotic material, pornography, and gambling. That's what we use the internet for. The internet is anonymous, inexpensive, controlled by the user, validating, rewarding, convenient, and escapist. Logging on at every chance at home. Okay, the symptoms of internet addiction include logging on at every chance at home or work. Not addicts will log on an average of 8 hours a week. Addicts may log on 40 plus hours a week, obsessing about the internet, feeling irritable and anxious when not online. Time online increases to make the individual feel they have had enough, losing track of time when online, neglecting responsibilities to be online, allowing relationships to deteriorate with spouses, coworkers, family, and friends. Posting more messages and downloading more and more data, eating in front of the monitor, checking email frequently, more than once a day. Some internet addicts seek oblivion, wanting to zone out, while others seek frequent or constant interaction. Physical symptoms of internet overuse include blurred vision, chronic lack of sleep, twitching mouse fingers, relationship problems. The list of internet addictions includes cybersexual addiction, computer relationship addiction, internet compulsions, information addiction, computer games addiction. Computer relationship addiction entails individuals dealing more and more in their online fantasy world. They pull more and more away from their real relationships until they lose them. Eventually, the addict's cyber world replaces and becomes the most important aspect of their life. For online gamers, the game might start offline, and then as they improve, they need the competition of the online games. Like any other online addiction, gamers lose track of time while they are playing. Some gamers will spend every free moment gaming. Men, teenagers, and children play online more than any other groups. Whereas non-addicts will spend 20 to 60 minutes playing a game. A gamer will average 6 hours a day in their games. For the last 60 years, the most frightening non-substance addiction was television addiction. TV addicts may easily spend 6 to 8 hours a day watching. 60% of American homes contain 3 or more televisions. In many American homes, the television is on longer than their lights. The benchmarks for TV addiction: compulsive use, making the individual a couch potato, using television to change one's mood, sedative or antidepressant, craving use, loss of control, continued use despite adverse consequences, development of tolerance. The average adolescent watches TV for 1,500 hours a year as compared to 900 hours they spend at school. The shows that an addict watches skews how they see reality and leads them to make poor decisions. Since television shows dysfunction as normal, adolescents have a hard time accepting their own culture as real. Commercials for fast food may lead to compulsive fatty food consumption. News focus on negative events leads to the individual to skew towards seeing the world as an especially dangerous place. A study in New Zealand showed that the more the child watched television between ages 5 to 15, the less likely they were to graduate from high school or go to college. And this is New Zealand right here. There are over 260 million cell phone users in the United States. There are over 6 billion cell phone users around the world. Calling and texting takes up a large part of a teenager's day to the exclusion of studying or engaging in face-to-face relationships. And that is finally the end of the chapter. Next week, I think we are dealing with chapter 7 again, so we will tackle chapter 8 in April. So I'll talk to you later.